How long did you like work in Gatundu from setup?
I worked for 4 years.
4 years.
Yes.
Right.
And I left the place, an amazing place. The same staff who were actually complaining at first,
they
really embraced it. They were so happy about it, and I'm sure you got a lot of emails from them.
Yes.
Because they really embraced that clinic. Wow. Even the staff started being seen there. Some of them left private hospitals to come and be seen there.
Okay.
Yes, so it really brought a lot of impact. And in the community, we even engaged CHVs and the public health officers who are even given strips and even digital BP machines to do screening in the communities. And you are able to visit them at least every Friday with the help of health promotions officer, Alice Mongi. We would go even without transport. We'd use our own transport. Wow. Yes.
Kujipeana kweli. So as we speak that Gatundu DCC, what services, if anyone with diabetes walked there, what kind of services would they expect?
A lot of, actually all the services. All the services.
So from maybe if you could mention them.
From screening, from education.
Okay.
Every patient, in fact, even right now here in Thika, we have, in the morning when we come in, we teach all our patients. Every new patient we have a one-to-one health message. We also make sure that every patient does not go home with a question. And what we do is that we are really friendly to our patients so that they don't fear to ask any questions. So they come to me and I normally give them a shoulder to lean on.
Okay.
Yes.
That's really nice.
So I was even awarded in Gatundu. I was awarded as the best nurse by the county and also by the hospital in 2015 and 2016. No, 2016 and 2017. 2016
and 2017.
Yes.
Okay. You see, now it all makes sense. It all adds up because in 2016 and 2017, if you're already bagging the best nurse awards, it all now makes sense why people are even nominating you, because there's really something I think special about you.
Yes, I've also been able to reduce amputations.
Yes.
Patients who are in the verge of being amputated have been able to make sure that they don't get amputated.
How do you
One
do
of
that?
those patients, by making sure that in case they have a wound, there's a way that we dress them to make sure that it doesn't get septic. Because most of the patients are actually killed by septicemia. And a diabetic wound will grow very fast. So first of all, we educate them a lot. In fact, during these visits, we do education for foot care, and we also do we do examinations in their feet. Those who have questions, we see them, and
it's fine.
At the end of the day, we are able to reduce those amputations. So I've had quite a number of patients, and one of them is the patient that I was telling you about.
All right.
Yes.
So you're saying here you offer, especially in Thika, you offer the foot care and all education. Are people able to get lab tests here?
Yes.
All right, like HbA1c.
But unfortunately, some of them are not able to have them because of the cost. Because somehow we have poor patients. But sometimes we make sure that they get the drugs. And we also have a program for the children through CDIC, DMI, and the Ministry of Health.
That's what I want to hear more about.
Yes. We deal with children with diabetes. In this clinic, we have 130 children who are diabetic, and we do give them free glucometers, free strips, free glucometers, free drugs, and even the lancets, free of charge. We also take them for camps so that we educate them together with their parents, so that they know exactly what they are dealing with. And I want to tell you that it has really helped our children. In fact, DKAs are so rare in Thika. From especially actually DKA even from even type 2s. It's a rare thing. Yes.
Oh, that's really good. So how does one enroll in this program? Like, is there, of course, you have said you need to be like a type 1.
Yes.
Is there anything different? I mean, is there any, do you consider age or anything? Or
we consider age,
okay,
at least from 20 years and below.
20 years and below.
Yes.
All right.
But if they are not able to get the drugs, because there are those patients who are very poor.
Exactly, especially
We just
also right now with the COVID and all that.
Yes, we just chip in and help them.
Okay.
Yes.
That's really, I'm happy to hear that. So just to repeat what you said is that if a kid is type 1 here and they come to Thika Level 5 hospital, the ECC department, they're able to get free drugs, which is including insulin.
Yes.
They're able to get strips and glucometers and even lancets.
Yes.
Okay, that is good. So you already have, in that program, you have 130 kids.
Children.
All right.
And we are getting new ones every day.
Okay. I have an interesting question.
Yes.
In my observation, or rather for the time I've been involved as a diabetes educator, I would say that, I noticed that generally the area of Mount Kenya has a bit of higher prevalence when it comes to diabetes. I don't know, why would you think, in your own opinion or perspective, why would you think is that, number one, is that information correct? Number two,
it's very correct.
Why is that so?
That information is really correct because in Kikuyu land, I think tulichanuka mapema, if I may say, or something, because people started eating in a bad way. They would get the maize, for example. Let me talk of Kakamega, those sides. People still eat wholemeal ugali. But here in Kikuyu land, people don't know about wholemeal ugali. They will sell all the maize, buy number 1 ugali, and even when it comes to rice, they will eat rice together with waru, potatoes, they mix. So their feeding habits is a challenge. And that is why we have so many people with diabetes. Feeding habits and also the issue of exercise. People don't exercise. Even if you ask our patients here, when we are teaching them, we normally ask them, wangapi walikuja miguu from town to here? And they'll tell you, I just had to have a nduthi man to carry me from home to...
Or you have my own car or maybe my son or something.
Yes, those who don't have cars, they have a nduthi man who will bring them here. So exercising is also an issue.
Okay.
Yes.
So generally the Mount Kenya higher prevalence is as a result of lifestyle, mostly sedentary lifestyle.
Yes.
And also maybe now, as you said, poor diet. Poor eating habits. Yes. So thank you so much.
Yes.
So maybe as a final point or question from my side, I mean, we are going to announce a winner soon. I want to first, of course, wish you the best.
Thank you so much.
But even before we announce the winner, in our program, when we sat down as DMRC, we said first, each nurse must get even 5,000 shillings as just appreciation first. So we'll be able to give you that before we leave here. But I know there are so many people who are going to watch our video, and a lot of people in our community, of course, are diabetic, either type 1 or type 2, or their caregivers. And they, of course, as you're saying, most people, let me tell you, one of the things that sometimes really, I mean, information is important. Sometimes people don't know even there are programs that could give kids with type 1 diabetes free insulin. People don't know. That's why we are coming out here to try and inform people all these things. So what message would you give to the people who are watching us, especially those who say that who are type 1 diabetic, type 2, or who are caregivers?
I'd like to welcome them to Thika Level 5 Hospital. We are here for them, for the diabetic patients, and our services are very good. And we normally give free services to the children, all the children from wherever they come from. We give them services. We also educate our type 2 patients, a lot of education to make sure that they know what diabetes is all about, what is really expected of them. Yes.
Okay, thank you so much. So anyway, thank you guys for watching. we will be able to take like a minute or two to just try and understand what happens here around. And then, as you have heard, Thika Level 5 Hospital has really a very good diabetes care center and clinic. So you're welcome here anytime. Thank you.